It seems we've ventured into a social media landscape where empirical claims are being weighed against opinion, a matrix that has perhaps never been as relevant as it is in the modern age, where access to information is unhindered yet often contaminated with unverified or even spurious content. In this context, Layne Norton emerges as a figure who brings a veneer of scientific rigor to discussions on diet, nutrition, and strength training. With a PhD in nutrition, he is far from an armchair commentator, and indeed he has amassed a wealth of knowledge in these domains. And I'd add that he's a seasoned strength athlete, and therefore his contributions are worthy of our attention. Layne recently posted this video to his @BioLayne account.
Some of you aren't going to like this video. I get a lot of questions asking about what I do now to prevent injuries. There is nothing you can do to prevent an injury. You can reduce your risk of an injury. Let's talk about the injuries I've gone through. 2 herniated discs in my lumbar spine, 2 bulge discs in my lumbar spine, 2 herniated discs in my cervical spine, a fully torn right pectoral, partially torn left pectoral, partially torn left adductor, partial muscle tears in both of my hips. And yet, a few weeks ago, I squatted over 600 pounds and deadlifted over 700 pounds. How is this possible? In the systematic reviews and the randomized control trials, it is quite clear static stretching does not reduce the risk of injury. What does? Sleep. 235% increase in risk in people who were sleep deprived. Having a systematic sport-specific warm-up procedure, getting your heart rate up, okay, through some means, and making sure you have a repeatable sport-specific warm-up. If you've incurred an injury or something like that, first thing to look at is reducing the load. If that's not sufficient, look at reducing the rate of tempo. If that doesn't work, try slowing down the tempo with a pause. If that doesn't work, then try modifying the range of motion. And if those things don't work, then you have to look at changing your exercise selection and looking for something that still stimulates that area, but doesn't cause pain and doesn't make that pain response worse.
For the most part, I agree with his comments. However, there's a non-trivial dispute here regarding his assertion that injuries are something over which we have no control. To play devil's advocate for a moment, I've also, for a long period of time, been more inclined towards the terminology of injury mitigation than injury prevention, motivated by the intent to make people more resilient, or, to borrow Nassim Taleb's term, anti-fragile. But a recent paper in the Journal of Science in Medicine and Sport compels us to reconsider the terminology we employ, primarily for 2 reasons. Firstly, the notion that we cannot prevent injuries appears to be an instance of semantic dissonance between Norton and a broad swath of the scientific community, including epidemiologists and organizations like the World Health Organization. It's a question of definitional integrity, and a unified vocabulary is essential for coherent dialogue and practical applications. Secondly, the term prevention already subsumes concepts of risk reduction and mitigation. If we relinquish the claim that exercise can be preventative in the domain of injury, we inadvertently sacrifice the notion that it can prevent anything else, like cardiovascular disease. Let's consider the example of vaccines in the prevention of disease. Vaccines are an instructive case study for understanding medical interventions, including those related to exercise and injury. In any vaccination campaign, there will inevitably be a spectrum of outcomes, from those who were always destined to get the disease, irrespective of vaccination, sometimes even developing the disease precisely because they received the vaccine, to those who, thanks to an effective immune response, were saved from this fate by the vaccine. These classifications illuminate the essence of prevention in epidemiological terms. The vaccine, in this context, both prevents and causes changes in outcomes contingent on individual conditions and responses. Analogously, in a randomized trial involving an exercise regimen designed to prevent injury, we would expect a distribution of outcomes. Some will get injured regardless of the intervention. Some won't get injured either way. Some will avoid injury thanks to the regimen, and some may even get injured due to the regimen itself. The principal point is that while we may not universally prevent injuries, we certainly modulate risk for a significant subset of the population such that some people will never get injured. Layne's analysis of the effect of stretching on injury prevention seems, on its face straightforward, but upon a closer and more rigorous examination, it reveals itself to be a hasty generalization. Layne's first oversight is his failure to disambiguate injuries based on their distinct mechanisms of action. Imagine walking into a room full of people suffering from injuries, fractures, sprains, muscle strains, and so forth. If you were to say, static stretching will not help any of you, you'd be missing nuance in a way that borders on the misleading. Certainly, stretching will not magically reattach a torn meniscus, nor will it mend a fractured tibia. But does that mean it has no role to play in preventing muscle strains? Well, the very study that Layne himself cites appears to conclude otherwise. It's as if Layne skimmed through the study's abstract, cherry-picked the one sentence that conformed to his pre-existing opinions, and then casually neglected to read further, where the authors do indeed discuss the role of stretching in reducing the risk of muscle injuries specifically by up to 54%. There's also the issue of the temporal context of the data Layne relies upon. Science is not a static endeavor. It's an evolving narrative of our best approximations of truth. To lean heavily on studies that were conducted between 7 and 18 years ago, as Layne does in his video, is to ignore the arc of scientific progress. It's not that older studies have no merit, it's that they can be, and often are, superseded by newer studies with more sophisticated methodologies, more refined investigative techniques, and larger sample sizes. In the year 2021, a review was published that took into account both acute and chronic effects of stretching on a myriad of variables, including injury incidents. This particular study found that while pre-exercise stretching might not substantially reduce or cause injury, there's compelling evidence that it does reduce musculotendinous injuries, especially in running-based sports. The problem here is not that Layne's advice is categorically wrong, but that it lacks the epistemological caution that such a complex subject demands. In trying to distill the complex landscape of athletic injuries and the efficacy of stretching into a soundbite, what emerges is an oversimplified and ultimately misleading narrative. Layne's analysis, while generally helpful, falters precisely where it ought to be most careful, at the intersection of nuanced scientific understanding and practical advice. It would seem, then, that Layne might benefit from a period of introspection to consider whether his approach was truly comprehensive or if he, too, should stay in his lane.